Dr. Bradshaw here again with Chirocynergy. Today we're talking about low back pain caused by the SI joint. What is the SI joint? Let's talk a little bit about that. On each side of your tailbone, and this yellow upside triangle represents the tailbone. This gray stack of vertebrae, that's your spine. On the right side of your tailbone, you have ligaments. There's a red one, a black one, and a blue one here indicating there's 3 different ligaments. And then muscles covering those ligaments attaching to the right side SI joint. And the same thing on the left side SI joint. When these get tight or get out of place, as the SI joint can, it causes low back pain. So here's what we're going to do. We're going to talk about some strengthening and stretching exercises you can do to help with improving the SI joint. The exercise I show you today is mainly a stretch. And here's how you're going to do it. You're going to take a bed at home that's fairly low. So you don't want it up to be too high. If you've got one of those really high beds at home that are almost up to your waist, this probably won't work. Find a different bed in your home. It's a little bit lower so you can use the side of it. Here's how it works. We're going to be working on stretching what's called the glute max, the gluteus maximus muscle. So it doesn't matter which side you start with. We're going to work with, in this case, the right one. You're going to bring the right leg up so that the ankle, the shin, and the knee lay flat on the side of the bed. Once you're there, the leg that's on the ground, the opposite leg, you're going to hop it backwards, forcing you to lean forward like this, okay? You're going to lean forward. Now, some of you may not be able to get this deep into it. That's okay. The goal is eventually to be able to get so you can lean forward and really get into this stretch. You will feel it right here in the SI joint. But even if you only get to right here, this is okay. Some of you may not even be able to get the knee down, in which case you can put a pillow underneath your knee to help support it. And that your knee might even be up like this, but with a pillow there, it won't hurt your knee. You can still lean forward and stretch this out. So once you're into the stretch as deep as you can go, then you're going to hold that for 5 deep breaths. And each time you exhale, see if you can go a little further into it. After 5 deep breaths, you come up, and you will feel like this muscle has lengthened like a mile. It will be much longer. It'll feel much more flexible. You might feel some tingling and some blood flow in there. That's what we're looking for. Then we're going to switch. The left leg up, same thing. Ankle, shin, knee on the side of the bed. Take the other leg, hop it back, lean forward, get into it. 5 deep breaths. After 5 deep breaths, you come back out of it. Once you have done all of that, that's 1 cycle. I'd like for you to do that at least 3 cycles a day. For those of you who are on the computer a lot, or you do a lot of driving, you're a truck driver, you probably need to do this once an hour to really get it to stretch out. So that's something you can do at home. One other quick alternative that you can do as well, instead of actually doing it on the bed, if you can't even get into that stretch like I showed you, you can sit on a chair. You can bring the ankle up onto the knee like this so that you got your leg crossed. And then you're going to lean forward into this bent knee like this and lean forward. Now this you can do at work. You can even do it, if you're a truck driver, take a break, you can lean, get in the passenger seat and do this stretch if you don't have a bed accessible to you at work. That's a good one too. Again, you lean into it, hold it for 5 deep breaths. But the one on the side of the bed, that version is by far the best. Enjoy.